So yes, okay, it's being recorded. Great. Okay, so hi, my name is Sean. I'm a speech language pathologist. Probably walking in the same, or previously walked in the same shoes that many of you um, are walking or are going to walk in. And I'm looking forward to speaking with you all today. So, I see a few familiar faces. Hello, Roseanne. Nice to see
Hi,
you.
Sean.
Nice to see you. Um, so I'm going to share my slides. I'm pretty informal. So if anything comes up, if you have any questions, by all means, just stop me. Um, Ask a question, put it in the chat. I was telling Carol that I'm pretty horrible with anything tech related, so feel free to just shout out. And Carol, if anything comes up in the chat that I'm not seeing, feel free to just stop me.
Okay,
Okay,
sounds good.
great. So let's see if I could successfully do this.
Yeah.
Okay. So, are you able to see everything? Or like, okay, the slides are probably not looking that pretty. But what,
Zoomed in.
zoom in?
Yeah, it's a little zoomed in.
Oh, how's that?
Okay, let me see. Oh, okay, it's good.
Okay, okay. So yes, so I was asked to speak a little bit about gender affirming care, but also a little bit about my background, getting into speech language pathology. I didn't know really how to tie it up. So I added a few slides at the end about just like liberatory practices, right? The things that we don't really get to talk about in speech language pathology. And I think that this blends nicely to gender affirming care and care for our minority populations and also for ourselves, right? We take care of others, but it's really important to know how to really take care of ourselves and take care of our colleagues in our field. So that's kind of what I wanted to talk about. If it seems very gestalty or not that focused, that's okay. I'm saying that mostly for myself, but also just know that it's very nebulous. So I hope that, feel free again to just unmute and ask questions. So let's get started. So yeah, so talking a little bit about myself. So my name is Sean, Sean Moonsammy. I use he, him pronouns. You could see here, this is my dog Lola, and there's a piano in the background, and a lot of that'll make sense in a little bit. So I am a professional opera singer. So before going into speech language pathology, I went to a performing arts high school in the city, LaGuardia Performing Arts, where I was exposed to opera and musical theater and just a whole slew of performance. And I ended up getting my bachelor's of music and master's of music in opera performance. And during that time, I was performing a ton, and I just realized like I cannot get old doing this, traveling all the time, and I was always teaching voice. I was giving voice lessons, which was very different from performing. And I said, you know what, I feel like there might be something out there where I can do this, but maybe work in medicine. And I did some Googling and I found speech language pathology. And I said, yeah, I'm going to do that. I'm going to work in voice. And I was in for a rude surprise when I found out there was a ton of child language disorders and, artic and swallowing. But it was all a good surprise. I ended up loving it all. But I was a brat from day one, and I said, I will work with voice. And that's actually what I ended up doing. So yeah, I got my master's in speech language pathology from Queens College, and I graduated in 2020. And then I did my fellowship at Stony Brook Medicine at 2020 at Stony Brook University Hospital. And then about 2 years later, I decided to, I don't know why, go into my doctoral studies at Massachusetts General Hospital, well, I know why, but there was a lot that I couldn't answer. And I felt like I needed to know how to speak to administration. Again, things that they don't really tell you in graduate school because there's so much to learn in graduate school, but also do a lot of more support work with our communities. And that's why I decided to go into my doctoral studies at MGH. So I'll be done in, well, May. Gosh, it's less than 2 months away. But for all of y'all taking tests and writing papers, I'm right there with you. Okay. So here's a little bit about my performance. So I tried to make this pretty, but again, I'm really bad with anything tech related. So my performance background was a lot of musical theater, opera. You could see a lot of the tour work that I did and commercials that I've done. And yeah, so there it is. And this is my graduate class of 2020 from Queens College. Missed them dearly. Because I was a class of 2020, we were luckily able to have a lot of live sessions. But then, of course, the pandemic hit, and we had to finish our last 2 months over Zoom. So this was our last day of class. I think this may have been graduation for us. So we were just having our little cheers for graduation. And straight after that, I went into, well, thrown into COVID. So I went into medicine. The photo on the left is me doing inpatient care. Then on the bottom, you'll see me doing telehealth. So, didn't have any of that training in graduate school, but you kind of you do what you can. And then you'll see my colleague up at Stony Brook. That's Dr. Keith Chadwick. He's one of the ENTs that I work with. Well, he's pretty much the only one that I work with there. He also specializes in voice, also a singer. So we see a lot of singers together. And then on the bottom right-hand corner, you'll actually see one of my previous students who recently just finished with me at Stony Brook, who's also in the Queens College graduate program. So it's nice to see things floating back full circle, right? So, I was once a student at QC and now I'm supervising students at QC and very proud of Corey's work. Okay, and
He was also president of NISHLA a few years ago.
oh yeah, yeah, he's a game changer. So,
Yeah.
it's nice to see, all that he's doing. And so yeah. So Corey was a part of our team at Stony Brook. And again, this is Dr. Chadwick, this is myself. We run the interdisciplinary voice clinic at Stony Brook Medicine. So we see patients together. We see a lot of singers, general voice users, and our gender affirming patients. So that's going to be the bulk of today's talk, gender affirming care and how we came about with this clinic and what we do and what you guys can think about going forward in your studies. So here's a little bit about our clinic. So Stony Brook Medicine, or you'll sometimes see this as Stony Brook University Hospital. I use them interchangeably. Our voice clinic is Long Island's first and only interdisciplinary gender affirming voice clinic, again, in Long Island. So patients previously, were seeing general ENTs and getting sent out for services for voice treatment by a speech language pathologist. However, as we'll talk about later in the slide deck, a lot of providers aren't really aware of the type of treatment to provide, and sometimes patients are, producing a voice with a lot of strain or not feeling satisfied with the outcome. So, what we hope is that at Stony Brook, we're able to really take continuing education courses, have specializations in voice, the providers, and be able to treat the patients the best way that we can. And if we can't, then we refer out. And I always say the biggest limitation to working with me is that I am a cisgender man. So, coming to see me for treatment is not always optimal because I don't walk in the shoes of my patients. But, sometimes just, and that's something some of us will share in this talk, but it's important to know that it's really important to refer out when a patient just isn't meshing with you. And that's okay, right? Because our outcomes should always be for the patient. And yeah, we provide gender affirming voice care to gender diverse populations across rural and suburban New York. So, I'm a Queens boy. I went to school in Manhattan, lived in Queens most of my life. And the care is really really robust in the city. However, that's really not the case in Stony Brook, which is about 50 miles away from the city. And I actually have a link. Oh, will it open? Let's see. Oh gosh, I don't know. Are you able to see this, or do you still see my slides?
Still see your slides.
Okay, let's see how I could do this. Stop sharing. Oh, no.
You can do a new share.
A new share. Okay.
Should be in.
Let's see. Share. Chrome. Okay. Share. Okay, so I'm going back to this video. This should be it. So this is a video of our patients, kind of our services. So I don't know if this will show. Are you able to see this?
Yes. Is there a sound that goes with it?
Oh, yes. So that's not working, is it?
No.
Okay. Okay. Well, I'll send it out to y'all so you can watch it later. But it's a little bit about a patient testimonial about, the type of care that exists. Okay. I told y'all I'm just really bad at this. Okay, so okay, are you able to see now?
Yes.
Okay, great. So, when we look at Long Island, and a lot of us are from Long Island, um, you're going to be providing care in Long Island for graduate school. The care for LGBTQ communities it's pretty limited. And I'm not going to read through all this for the sake of time, but you know, the disparities for LGBTQ care in Long Island is much higher than national averages, right? So when we look at things like chronic depression, seeking mental health care, or even, you know, uh, prevalence of um, alcohol use or addiction, those things they're a lot higher in Long Island and for LGBTQ communities compared to the States. So that's why it's really important to get out to these communities right now and talk to them about, hey, you know, the outcomes that we expect or that we will try to talk to the patients about when it comes to voice and when it comes to speech language pathology. When we work with the voice, we want patients to be vocally healthy. Or sometimes when they're smoking or when they have excessive alcohol use, that kind of precludes them from surgery because we need those vocal folds to heal after surgery. So sometimes patients will come in and we actually won't be able to, treat them with surgery because of their smoking history or they're they don't want to stop smoking. That's okay, right? That's okay, but we just have to make the patients aware. But sometimes patients aren't even aware that these things will preclude them from having surgery. And when we think about gender-affirming voice care, our job is to raise awareness about the instrument, right? The voice really is an instrument. It's really a combination of your respiratory system, your phonatory system, the way that vocal cords turn on, and also the way that that sound is filtered. And we also have to establish trust, right? As therapists, we have to make sure that our patients feel like they're being heard, like they're being listened to. And we also have to affirm who they are, right? And so sometimes when we think about speech therapy and we think about voice therapy, it goes much more than just talking about articulation and about talking about the voice. A lot of it comes down to, hey, I see you, right? I'm going to refer to you the way that you want to be referred to and that the way that you deserve to be referred to. And, that sometimes is a therapeutic space that we really get to create with our patients. And it goes a long way in establishing that trust and also working on the awareness piece. So this is really uh, that you don't work on one or the other, you really work on all of them at the same time. And when we think about our patients who are coming to see us, there are a lot of barriers to care. And, that's something that you'll hear in medicine, and that's something that you'll hear in speech language pathology, barriers. And we also have to think about facilitators, right? So what are the things that we could do as therapists to optimize care, to get our patients in, to, go over those barriers? And those barriers could sometimes be personal, environmental, or institutional. And when I say institutional, I also mean, within college level clinics. And in hospitals, we might be doing well, we might have well intentions, but sometimes our hospital systems and our school systems need to be, policies need to change and administration. Sometimes people who aren't within the clinic need to be aware that, hey, this policy doesn't mesh well with the patients that we're trying to reach, and it actually stops them from coming. So when we think about barriers for our gender diverse populations, there's overall worldwide stigmatization, discrimination and transphobia, ignorance, and also refusal of care for a lot of our patients. And there's an overall divide over transgender acceptance, where most Democrats believe greater acceptance for transgender people are needed, where sometimes Republicans do not feel the same. And while New York has no anti-transgender bills, many states have already introduced them, and you've really seen a slew of that within the last year or two. So when we think about personal barriers, right? Our gender diverse folks pretty much have poor trust in medical facilities, and patients may not disclose who they are or their identity or previous experiences with the way that they identify, right? And that's usually because of the experiences that they experience within healthcare settings. And this number is it's always striking to me. 70% of gender diverse populations have faced discrimination in healthcare. And patients report concerns about insurance coverages and also out-of-pocket expenses to care. Okay. And those things are always changing because of the laws that are going really targeting our gender diverse populations. And again, I won't read all of this, but pretty much there are also environmental barriers, and this is something that we see a lot in Suffolk County and in Long Island. Non-urban communities are limited due to distance, right? So, when we look at Stony Brook and when we look at where Stony Brook is located, I could still drive an hour or two away and still be in Suffolk, right? And same thing going towards Nassau. I live in Garden City, but getting over to work for myself is about an hour away. So, there really is a huge span of space. And when we look at Suffolk County, it truly is a non-urban and rural area. There are true farmlands in Suffolk County. So it's something to consider if you're going to be working in a rural or suburban area. And distance and travel seem to be the most significant barriers to our LGBTQ committees in Long Island. And issues, specific to us, behavioral health. We're considered behavioral health as speech language pathologists, and training to providers and to SLP programs it's really important. And we'll talk about some of those numbers specific to speech language pathology in the coming slides. So institutional barriers, right? This is where we come in, right? This is where we are, in academia, in medical facilities, and in schools, right? So, a lot of medical providers, physicians and postgraduate and undergraduate medical students are not fully equipped to provide high-level care to our gender diverse populations. And specifically in speech language pathologists, 47% of SLPs indicated gender affirming training in graduate school. So personally, I did not receive any gender affirming training in graduate school. I know that's changing, but that's a pretty striking number, and I'm not sure where that number is now in 2024, but hopefully a bit higher. And 51% of SLPs cannot adequately describe the components of gender affirming care. And we'll talk about this again, but sometimes clinicians will only think about care as pitch, right? So how do we bring the pitch up? But that's really not most of what I usually train patients with, and we'll talk about that. And when we look at the patients who are looking for care by speech language pathologists, a lot of patients have found that the care is cumbersome and they're discontent with the care and the quality of information that they do find. And we know that patients are usually more aware of medical intervention versus behavioral. So medical are things like surgical, hormones, but when we think about behavioral treatment, that's really with the speech language pathologist. And sometimes patients don't even know that we're here and that we do give this type of care. So going into this now, what is care, right? What do SLPs do? So it's more than pitch. So I want everyone to close their eyes. Roseanne, you've probably seen this. You've probably heard me do this before, and musicians will have a little, head start with this. But I'm going to give two different scenarios. I'm just going to say something. Number one is going to be a little bit different than number two. So I want you to tell me which one you perceive to be higher pitch. Okay, and you could type it in the chat, you could raise your finger, you can do whatever you want to do. Okay, so here's number one. 1, 2, 3, 4, 5. Here's number two. 1, 2, 3, 4, 5. Now, which one do you perceive to be higher in pitch? Again, here's number one. 1, 2, 3, 4, 5. Number two. 1, 2, 3, 4, 5. I see some things coming in. Thank you, Carol. So anyone else? Which one is higher in pitch? Thank you, Caitlin. Huh? One. Yeah, it seems like one is a consensus here. Yeah. So they're both actually the same exact pitch. Yeah. So I'm at my piano right now. I don't know what note that was. That was a B. So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay. So that's something to keep in mind, right? So we perceive pitch as being higher when we shift our resonance. So we can make our sound really bright or we can make it pretty dark, right? And that's something that we usually start with patients. And then we think about vocal weight, right? So right now I'm making my voice pretty heavy, opposed to I'm speaking with pretend like I'm speaking to a baby, right? Like 1, 2, 3, 4, 5 versus 1, 2, 3, 4, 5. Right. And then we think about articulation, right? So could we make our articulatory patterns a little bit more crisp, opposed to making them a little bit more harsh, holding on to our postures a little bit more. And then prosody, right? Prosody, for those who aren't familiar with that phrase, are things like our suprasegmentals, right? So how's our intonation pattern? And are we staying down? Are we dropping our pitch or are we kind of, floating? And we work on overall gender congruency and safety, right? Like how safe do you feel using the voice that you use? How unsafe do you feel using the voice that you use? Those are important conversations. And what context do you feel safe practicing the voice that we're practicing in the clinic room, right? So do you feel comfortable just sending me a voice memo or a voicemail, right? Or those are things that we talk about with the patient. And overall, these are just tools for the toolbox, right? I don't know what a voice should sound like. I don't know what a voice that is congruent with a patient should feel like, right? I hope that there's a place that isn't here for me in gender affirming care one day, because I hope that I think I personally believe all voices are beautiful, right? And that's something that we have to keep in mind, right? And even working in general voice, my goal is to never make a patient sound the way that I think they should sound, right? Who am I, right? So that's something that we have to keep in mind as therapists, right? Like, how do we provide a patient with a communication style that is congruent with them? Okay, so we'll talk very quickly about building our clinic. So, it was never here. Gender affirming voice care was never at Stony Brook. Um, and I'm a gay cisgender man coming into Stony Brook, kind of turning things upside down and saying, "Hey, I don't know if we should be doing these types of things. I don't know if we should be saying these types of things." Coming in and changing policies and trying to make things a little bit more inclusive. And that comes with a lot of training, right? So training your staff, training your providers, and luckily I started with Dr. Chadwick, who is um, also coming from the city, around my age, and also a part of the LGBTQ community. And I was really lucky to have him as a partner to kind of shake things up. And a lot of that came with training to our staff, right, and using gender neutral language, right. So earlier today, and I try my hardest to call myself out and to know that, hey, I was born in a generation that used binary languages, that, was exposed to many things binary. And earlier today when I introduced myself to y'all, I said the word guys, right? And I try my hardest not to use that anymore. So, I think checking in with ourselves, knowing that, hey, like there are other ways to announce yourself to people. There are other ways to say like, hey, how are y'all doing? How is everyone? Folks, right? Little things like that. I try to check in with myself, and that, I know I have control over that. And that's something that, as you continue on with your graduate studies, it's something to consider, right? Like, how do we check into ourselves and look at our own biases? And see how that influences not only our patients, but our cohort, right? And our academic leaders, right? So, those are things to consider, and know that you have power in that. Right, and we're going to speak very quickly about pronouns. So pronouns just affirm gender identities and create a safe spaces for students, while misgendering results in marginalization and communicates that a person's identity is not seen as important, right? So how do we make people, including your classmates, including your professors, how do we make them feel important, right? And how do we make them listened to, right? And I have some it's not going to work if I click on them, but there's some videos that I made about pronoun usage within clinical settings that I could also email out to Carol. So pronouns are for everyone. If you make a mistake, that's okay. Apologize and continue. Don't harp on it, right? Because we don't want to switch kind of that dynamic there, right? We don't want the person who is misgendered to say, "Hey, it's okay that you did that," right? That's not fun for that person. So apologize and continue, and practice, right? Practice pronoun usage and correct pronouns with your cohort, with during seminar meetings. Those are all things that those are all opportunities for us to just check in and practice using. Now, I wanted to talk about this. So this is kind of a biggie for me, and this is where things start becoming very nebulous. So feel free to unmute, feel free to put your cameras on. I don't mind if you're in, non-clinic clothes or so. It's all a social construct, but DEI versus JEDI, right? So we know, diversity, equity, inclusion, that's something that's kind of thrown out there. I like using Jedi, and Jedi simply speaks to, and it's not simple, but justice, right? And action. What are some things that we can do as students, right? You have a lot of power as students, as providers, as folks within speech language pathology. What are things that we could do to create actionable change to promote diversity, equity, and inclusion, right? It doesn't matter what you call it. It really doesn't matter what you call it as long as you do something, right? So diversity and inclusion has sometimes become feel-good terms, and it's just a reminder of power dynamics within institutions, right? So within academia, within healthcare settings. And it really could marginalize a lot of students. And I'm saying this as someone, who is brown. It's sometimes it's hard and it's awkward to be in those spaces where DEI is kind of brought up. So just knowing that, yeah, that exists, that's a thing. So leading with justice and equity is a significantly different framework because it prompts us to think about systemic barriers to access, engagement, and success at the forefront of our work, and how we can transform an organization to eliminate these barriers, right? So think about that as you're moving forward with your careers. Okay, and I'm more than happy to talk to um, anyone about this. And I want us to all remember this word, liberation, right? What does a liberated space look like to you? And this does not have to be in healthcare. This could be in your classroom, right? This could be in your cohort. What does liberation mean? For me, in my little space at Stony Brook Medicine, I want someone that I can go to and talk to about things that I've experienced. Maybe I've experienced racism that day. Maybe I experienced homophobia that day. And I want to talk to someone about it. And I want to know that they're there to listen, right? So it's something that, I'm asking you all now. And you don't have to answer. You could put it in the chat. You can talk about it. But what does a liberated space look like to you as graduate students, as undergraduate students, right? I'll give it like 30 seconds, but if anyone wants to put it in, maybe it can mean like, yeah, like more leniency with coursework, more, because that's a big thing, right? Especially at QC, a lot of us are first generation students where, we're not taught the routines of what to do, right? And okay, but no one's responding, but think about it, okay? And I want us to just end with this. Justice is what love looks like in public. Okay, and that's a quote by Dr. Cornell West. Justice is what love looks like in public. So I want us all to just remember that and to remember that as we go through our careers. And, if you see something like I saw at Stony Brook, where there was a whole group of people who weren't being seen, who weren't given adequate care, who weren't being referred to the way that they wanted to be referred to, or that they identified, or they weren't being referred out to, providers who could help. You know, do something, right? It could be small. It could be reaching out to a professor to get some advice. It could be reaching out to another student to say, "Hey, I'm seeing this. Could we do something about it? Could we give an outreach talk?" Okay. And the list goes on. And any questions that I can answer, it doesn't have to be related to gender affirming care. It could just be, about how you're feeling, what liberation is, how do we create action in speech language pathology? Um, or if you just want to talk about how stressed you are, I'm okay with that too. So feel free.
Thank you, Sean. I did have a few questions.
Sure.
I wanted to ask about just a client story that really stuck with you throughout your time since you've graduated.
Hmm. Since I've graduated. Oh, that's hard. That's hard. That's a lot.
Yeah.
So
That's okay to
it's great. You know, I think the biggest thing, and going back to gender affirming care, um, one of my patients came in so defeated about where her voice was and just kind of laughing at the fact that she even came to voice therapy. And I don't like calling it voice therapy, but voice training. Um, and after the first session, she was just like, yeah, oh, this is what I can do, right? And at the end of it, she really became an advocate for speech language pathology, became an advocate for gender affirming voice care. And I think that has always stuck with me. She's never opted for treatment. And her voice is stunning. It's always been stunning, but it was congruent with her, right? And I think those are the things that stick around. Those patients who you're just kind of like you see in a very defeated circumstance, and you just see them becoming champions of their own voice and agents for their own voice. That's what stuck around.
Yeah, that's really nice and helping them get there.
Yeah, it's rewarding what we do. I really do think so.
And I did have another question about you.
Mhm.
Since you're in medical school, how will your experience as an SLP change from doing this program?
Yeah, so my program is actually a clinical doctorate in speech language pathology. So it is a mixture of research and clinical work, right? So the clinical work is more so the things that we don't get to learn in graduate school, things like justice, things like well, I'm not going to bore you with all the research-based things, but how do we take our healthcare systems and elevate them to a place where they weren't before, or how do we do that with ourselves as clinicians, or how do we do that for our field, right? So it's really just becoming a leader in something. So the way that I think I'm going to change as a provider, I think that's what you're asking, right? But um, I hope to be more of a game changer in fields that are a little bit more difficult to manage. So Stony Brook it's a state hospital. So people usually don't leave unless they absolutely have to. And what that means is that we're really sometimes stuck with a lot of clinicians or administration who don't, I hate to say this, but who don't believe in gender identity, who don't believe in DEI. And our hospital system for sure 100% believes in it, but sometimes you'll meet some of these providers or these administrative folks that don't. It's a hard battle. So just knowing how to speak to them and how do I put myself in a position where, hey, I could apply for this job and get it and be qualified and probably do a good job to open doors for other folks. So I hope that answers the question.
Yeah, of course. I wanted to know like what would change for you and how you would use it, but that's so great that you really want to make a step towards your mission.
Yeah, no, I think we all want to help as SLPs. Sometimes, and I went into things a lot later. I went into speech language pathology. I was in my third. I was 30 when I started. So I just felt like I just needed a really big head start because I wasn't in this for about 8 years like most of my other colleagues. Yeah. Any other questions or comments or concerns or points of contention? They don't have to be questions.
I also wanted to ask about your doctorate process, kind of how it was transitioning to that from QC.
Yeah, well, I waited 2 years. So I graduated from QC, did my fellowship, and then 1 year of clinical work. And I applied for my doctorate. I didn't know whether I wanted to go into my PhD or clinical doctorate. A PhD, my husband is a PhD, and he kind of talked me out of it. And he was just like, if you really don't like research, and which I really don't, don't go into a PhD. So the reason why I picked the SLPD is because it's a good fusion between the two. So you see researchers sometimes, and then you'll see clinicians. The SLPD will be right in between to help blend those two worlds. So, going into it wasn't horrible. The application process wasn't horrible. It's again talking about yourself, writing your personal statements, getting your letters of recommendation, doing your interviews. Um, and and I started. And my world was just crazy again. As you can imagine, I'm working full time, so I'm able to work full time. I teach part time, and I have a per diem job, and then I also go to school full time. So luckily, because of COVID, we didn't have to travel as much the first year. So a lot of it was done online. So I was able to, really, really hone into my time management skills which wasn't always successful, and missed a few deadlines, and that's okay. But yeah, so that was kind of my journey into starting it, and sometimes I still wonder how I'm awake, but it's coming to an end. And a lot of y'all might feel that way in graduate school. Just know there's a light at the end of the tunnel.
Yeah, that's motivating, especially with some people starting in the fall.
Yes, yes, exactly. Yeah, good luck to you all. It's a fun ride.
Thank you. Does anybody else have any questions?
So, Sean,
Hey.
out of your experiences at Queens,
Mhm.
what do you think lent most to what you're doing today?
Having been heard, I think that I had a great clinical director, Patricia McCall, who listened to me from day one. And maybe a lot of that was me advocating for myself. Again, I went into it a lot older. I felt comfortable having those hard conversations about like, hey, I want to go into medicine. I want to work in a hospital. I want to do voice. Um, so don't, especially if you're going to Queens. I can't speak for other universities because I just don't know. I can speak for Stony Brook, but that's pretty much it. But especially if you're going to Queens, just advocate for yourself. Say like, let them know what you want to do, and they'll really provide you with those opportunities to just make your CV and your resume able to get you into the places that you need to get into. And I think now at QC we're really changing the way that we look at voice. So, Pat has really, you know, we've opened up a contract at Stony Brook, so we're now able to take a voice student, and really set them up for success. So, advocate for yourself and just let your clinical directors know like what you want to do.
That's also what I really like about the Queen's program, that piece of liberation that you talked about, being able to talk to your clinical director and have it be so open.
Yeah. Yeah, and a lot of schools don't have that, where it's like you have to follow this script, you have to follow this template, and you will fit the mold. But we're not meant to fit in molds, right? So something, just remember that.
And even though we have a lot of child language at Queens, we have a lot more at Queens. And think about the faculty are largely clinicians.
Mhm.
So, or even the academic courses are taught by people who are still working in the field.
Yeah.
And this is true for your undergraduate classes too. I mean, we have a lot of Queens that are coming to us in the graduate program who are researchers, but a lot of us, like those of you who will have Professor Ball for anatomy, I know I have a few people who are just starting out in the CSC major. People like me, Professor Newman, all these folks have had clinical experience. So um, ask their stories. The same way that you're asking Sean what his experiences have been, because we'll share very happily.
Yeah.
Um, but there's a lot to, and speaking of child language, I'm just going to tell you something halfway coded. Um, Ryan always thinks of you when he sees a Chipotle, and I'm going to leave it at that. We'll talk more later.
I love it. I love it. I still love Chipotle.
But
Get it
hello
for
from
lunch.
Judy.
And you
And
know what? I'm sorry.
they're going to be people who stick with you, clients, you know, people you see in your graduate program, people you see. And there are people I've kept in touch with, and you see what a difference you make. And you really, but you realize it's them doing all the hard work. You get to be a facilitator, you get to watch them progress and grow.
Yes.
So you're going to be the biggest cheerleader,
Yep.
and you're going to use this education to help people to navigate the world, whatever the communication concern is, and whether it's feeling more like yourself out in public and feeling safe, or being able to say hi to your kids, you know, all of this, you know. And I hope some of you get excited about voice. This is an exciting area. And if you love music and if you're a singer and you've already been thinking about voice, you know, there's so much to delve into there. And from both a training perspective, like the work that Sean is doing, but also from a pathological perspective, when people have had injuries or neurological changes that cause changes to the voice. So there's a lot you can do.
So
So any tips for our crew about vocal hygiene?
Oh yes, vocal hygiene. Well, protect yourself, listen to your body, right? I don't have any prescriptions for, a certain tea that you should have, or like I'm not that type of dude. So, just listen to your body. If you're feeling like your pitch is low all of a sudden after a night of going out and having fun, or having something spicy to eat, right? That's usually a sign of inflammation, right? Always go and check it out if you need to. If you're feeling dry, unless you're on a fluid restriction, however much you weigh, divide that in two. That's how many ounces you should probably be having a day of water. It's usually more than the 8 cups of water a day. But again, if you're on a fluid restriction, no. Yeah, it's pretty large. I don't even know. Yeah, my water bottle's on here. Steaming is great, right? If you have a big vocal talk coming up, just go over a pot of water, towel over the head, steam it, take the vent off in the bathroom and just steam while you're taking a shower. And yeah, just listen to your body. Feel the voice up here. If you're feeling tension, if you're feeling strain, that's usually a sign that maybe there's something going on, something that we could ameliorate. And don't hesitate to reach out to voice specializing ENT and SLP. Specifically, a regular ENT probably won't have the right lighting that we use in our voice clinic. So you want to see a laryngologist. If you're a singer, you should see a laryngologist at least once a year, just even when you're healthy. Because I think about 83 or 88% of all healthy singers, when we take a look at this with a scope, 88% of them, or 83, have something on the vocal folds. There's something there, and it's just they're normal, right? Some people are just naturally inflamed. Some people naturally have a weakness on one side. Some people naturally have a scar. And
Right.
it's okay. It's good to know what you have. So we're not treating something that doesn't need to be treated. Okay,
Right.
so singers, go and check it out.
Love it. Thank you, Sean.
Yeah, no worries. Any other questions? And can I make a plug about the child language piece for a sec?
Of
That
course. Yeah.
is so helpful. I still use all of my child language pieces every single day when I'm working on the ICU, right? Working on engagement, working on intent, right? Those things come back and they haunt you. So, don't think that you're never going to use it. You will work on engagement and intentionality and, just, building language again. So always remember that.
Yes.
It sticks with
100%.
you. Yeah. Even though I don't work with kids, like that's it. Yeah. I should mention I don't work with kids. I can't stand it. So for those of y'all going in to work with students, the best of luck. Again, very informal. If you all have any questions for me, feel free to shoot me an email. If you feel like I could be a resource for you, if you have any questions about voice-related care or medicine, feel free to reach out.
Well, thank you
Thank
so
you
much.
so much.
Of course, of course.
Really
Thanks
helpful
for.
to have that piece after too.
I'm sorry.
It's also really helpful to be able to talk to you after and just like get to know more.
Yeah, yeah. No, I'm always here.
Thank you.
Of course.
So if anybody doesn't have any more questions, we'll end it off here. Thank you so much again, Sean, for coming in, for just being able to open up this door since we don't really learn much about it.
Of course. Yeah, of course. No worries. And to all of you in the chat, no worries. Thanks for having me and thanks for sticking around.
All right. Fantastic.